And the other category would be our K through 12 school staff and employees, our daycare employees, as well as our higher education staff and teachers. Those will be included in the two categories that will be eligible beginning next Monday, January 18th, for vaccination. The reason for this is we want to continue to increase as fast as we can getting these doses into the arms of our Kansans, and at the same time being able to manage the limited supply that we're giving. As you can see, 24,000 was received in the last 24 hours. We've been getting about 50,000 doses a week. I expect that to increase, and so we're trying for increasing those doses and getting those out as quickly as possible. If you go to the next slide, this is phase 1A now that I just went through, which is the healthcare workers, the long-term care facilities, and our other priority groups of first responders. That's where we are right now, and we have vaccinated to the point that we can move into two different categories, which is 1B beginning on January 18th. And as I indicated, we're doing Arkansans age 70 or older, and these vaccines are available through your community pharmacies. The hospitals are participating in this when they have the doses available. They can call ahead for an appointment, and there'll be vaccine clinics and events that may be available in your area. This is county by county approach in terms of the vaccinations, but we're increasing that opportunity for those to get categories. In terms of education, including higher ed and child care, the school districts will drive it. So if you're a teacher, check with your school district. Are you going to have a clinic? How are we supposed to get vaccinated? And they will have to work with their local provider, pharmacy, or hospital to schedule a clinic or an opportunity or an appointment to get vaccinated. This is working from each county and community to assure that vaccinations are available across the state and not just in one area. And then this is later in 1B. We're not all the way through 1B. This is where we'll get to later. But the frontline essential workers, we're not to yet. They don't start on Monday, but we will get to them. They're later in phase 1B. The next one, we're just reviewing the different phases and who's in it. This is 1C. And again, right now, this is people who are 65 to 69, people with high-risk medical conditions that are younger, and others. And this is all on our website. But this is something I wanted to talk about in terms of why we're doing priority populations, because we have a limited supply, and if we can bring in our workforce in education, which is about 132,000, that's a lot for our local pharmacies to handle. If they're 70 and plus, that's another 311,000. So we're looking at adding next Monday 443,000 new potential Arkansans to be vaccinated. Now we know that some will wait, but it's going to take time to get through all of those, but we're going to start that Monday. Now there is a debate in Washington. I understand there's been some comments nationally. Well, maybe we should go ahead and do 65 to 69 and bring in other categories early on. We have to manage the process in a way that gets vaccinated possible, but also in a way that doesn't, that gives priority those that need it the most. And so if you did 65 to 69, and by the way, that is, when we say 462,000, that is for everybody in Arkansas 65 up. So if you really wanted to look at that one category, you'd subtract the 311,000 from 462. You'd be adding another 151,000 if you went down to that level. We will get there, but we're not ready to do that Monday. And so those are the information as to what we're moving to Monday. Let's go to the next slide. And before I go to the next item of business, let me go ahead and cover our case report for today. And our case report for today, the last 24 hours, look in the middle right there, you'll see that we have added 3,209 total cases over the last 24 hours. This is down about 1,000, I believe it is, from a week ago. Our testing is higher than it was. We have 10,600 that's been tested, both PCR tests and antigen tests. The hospitalizations has decreased by 17, which is some relief for our hospitals, but with the increase yesterday, day before, we're still got a ways to go to give any real relief for our hospitals. It's still a challenge for us. And then the deaths is what we're anxious to reduce that number. We have 40 new Arkansans that are recorded as having passed away as a result of COVID-19. You can see our new cases by county as well, and it shows again our top population counties look to be in the top numbers. With that, I want to say a couple more things about our vaccination plans. As you know, last week I tasked General Penn and his team, working with Director A.J. Gary at Emergency Management, to work on a specific plan that the public can see, that they can know exactly what we are doing and how we are doing it. And I gave them a deadline of January 15th. They are on target to have this plan developed that will go on our website, and this is a draft of it that they're continuing to work on, but we expect that to be concluded in the near future, and that is part of our planning process with the Department of Health. Secondly, I wanted to recognize Colonel Robert Ader that stands here. Colonel Ader, come on over. He currently serves as Director of Military Affairs for the Arkansas Economic Development Commission. He's retired as the commander of the 189th Airlift Wing of the Arkansas Air National Guard. And as commander, he was responsible for the wing's 14 subordinate units, thousands of members, annual operating budget of $70 million. I have asked him, and with Dr. Romero's agreement, that he will come in as the program manager for the state's COVID-19 vaccine deployment. Colonel Ator will serve as a project manager for our vaccine distribution. And so his responsibility will be to implement with our professionals at the Department of Health the plan that it will be released by me. And he will manage the logistics related to the vaccine distribution and liaison to other state agencies to assist with the information sharing and data collection. Let me emphasize, the Department of Health has the lead in our emergency response, and they will continue to do. But this is a whole of state government effort. And whenever we need the logistics support, the technical support, the planning capabilities of the military, we're utilizing. And we're delighted that Colonel Ator is able to take on that responsibility. Colonel, if you would give a greeting, and then General Penn, if you would come up and give an update on the development of that plan.
Thank you, sir. Well, first off, let me say that I am humbled beyond words that the governor would trust me to do this for the state of Arkansas. I will tell you that every Arkansan should be extremely proud of the efforts that the Department of Health has done, and what they've done is nothing less than miraculous. And the problem that we're seeing is that as we go into the different phases and we expand the vaccination program, one of the things we're going to have to work on is capacity. And so we're using an all-state government approach to how we go about doing that. And I thank the governor for allowing us to reach to all parts of government. And like I said, we're going to be using the Department of Commerce. The military department obviously is very, very important to this. But we're using everything to be able to get to this so that we're servicing the needs of our fellow Arkansans. So I'm looking forward to the challenge and the opportunity, and I got to tell you that this is a big job, but it's one that is very, very meaningful, and like I said, every Arkansan should be very, very proud.
Thank you all. General?
Thank you, Governor. The Department of the Military has had the distinct privilege over the last week work in support of and with Dr. Romero and his team at the Department of Health, as well as Director A.J. Gary with the Division of Emergency Management, to put together the plan that we'll soon be posting out on the website. As we were looking at what needed to be done in large, broad terms, we realized that to make this an efficient process, that we needed to increase the capacity for giving vaccine across the state. And so we looked at what we need to do to enroll more hospitals, clinics, pharmacies, as well as, in some cases, private own health units, and to bring all of those into the fold and make them eligible to give the vaccine. We also looked at the need to manage vaccine distribution as well as the administration of shots. And so we've established procedures to enter data into a program of record, a management information system, if you will, that gives ability across state government to the amount of vaccine that we've got on hand, where it's at, and how often and how much of it that we are dispersing. We've also built in procedures where if a school district or some other large body wants to give a large vaccination clinic, the strike team, which is very much in line with the strike team concept used during flu season. And then finally, we've built into the plan the means to both communicate what the plan is to the citizenry, to the providers, and then also to coordinate information across state government so that we can manage the process and provide information back to Dr. Romero and the governor in time to make timely decisions. Sir, thank you.
Thank you, General Penn. And then Dr. Romero, we welcome your comments. And again, thank you for your leadership and partnership.
Thank you, Governor. So let me begin by acknowledging and thanking both the General and the Colonel for their efforts in putting together this plan and aiding us in getting this forward. It's clear that we are stretched between multiple fronts on this, and their help has been instrumental in getting this done. We will be getting more vaccine in the future. There is a third vaccine that is on the horizon. And will be discussed in the near future at the ACIP meeting, and hopefully will be approved by FDA. So vaccines will increase in the relatively near future. At this moment is that we begin to immunize those individuals at highest risk for morbidity and mortality, and that we can have the most impact. As has been stated by the ACIP on multiple occasions, the goal is to minimize disease, minimize adverse events, and maximize benefit of each vaccine. So with that, I'll turn it back over to the Governor.
Thank you, Dr. Romero. And with that, we'll turn it open to questions.
Pretty badly behind other states in terms of percent of the population that's been vaccinated. I guess I understand what y'all are doing now, but I guess what explains how it got to this point? Why has it been lagging so much?
The New York Times gave a report yesterday based upon some CDC information that was inaccurate. And let me invite Dr. Romero, who talked to the CDC about that, to explain.
So thank you. I also saw that report yesterday that placed us 7th from the bottom. And that alarmed me. So in reviewing the information that was listed on the website, comparing it to what we had, I spoke with the CDC. The numbers are actually incorrect. So when we calculated the number of doses given and the number of individuals we had administered as of yesterday, 39 0.7% of our total allotment to the state. We had that, when we calculated where we would fall in that column, we are 14th from the top. So the data is erroneous, and we are doing a good job at this time.
What's the percentage of the population that's been vaccinated?
As of yesterday, it was 2.7. As of today, it is 3%.
Thank you, Dr. Romero. Yes.
So by January 18th, there will not be, will there be available vaccine? Because we will still be vaccinating people in healthcare facilities and nursing homes. I don't know what percentage of the nursing home population has been covered or the percentage of the healthcare population, it has been covered. And will there be vaccine on January the 18th for people in those other categories?
There will be. There will not be 380,000 doses ready to give out on Monday. But whenever I talk to, whether it's Baptist or whether it is St. Bernard's, they have vaccinated the largest percent of those healthcare workers that wanted to be vaccinated, and they have doses there, and they're ready to move on to the next priority. And so they have doses, they're ready to move on. Is it enough to cover 400,000? No. But is it enough to start vaccinating in the two categories that we mentioned? The answer is yes. And that same thing can be said for many pharmacies that are out there. And then we're going to be getting additional supplies in. And I expect that whenever President-elect Biden indicated that he wanted to shift more of the vaccine in storage for the second dose to get to the state, I expect that to happen. And so while we're going to stick with that regimen of 2 doses for everybody, make sure we can accomplish that, we do believe that there will be increased supply as we go into the coming weeks.
So does that mean if you're a hospital worker and you have said no, thank you, then the hospital can go ahead and say, well, we're going to offer this dose to someone else if
Yes.
you're not interested?
That's exactly right. They had an opportunity for priority, which was important. Some chose not to take that priority, so we're going to move to other priorities. Yes.
Inmates are going to fit into the priority groups, and if they are in the 70 and older age group, are they going to be able to get it next week?
Dr. Romero, do you have an answer to that? The inmates are in, I believe it is 1C at the present time, and we will adjust that as there's further guidance or necessity or sufficient doses out there, but that's where they are at the present time. Do you have anything else to add on it?
Would that change if they're 70 or older?
I believe that they would stay in 1C, but Dr. Romero?
At this time, they will stay.
COVID question, the FBI had put out a bulletin about armed protests or rallies at all 50 state capitals. Want to see what kind of communication have you had from the FBI or Homeland Security about the threat level here? What kind of response are you taking here, and how concerned are you about the Capitol as a potential target?
Well, we take every piece of intelligence very seriously. We look at it, we evaluate it in terms of the national FBI intelligence that's brought to us through our Fusion Center. I stay in direct contact with them through our state police, and our first concern was the opening of the legislative session. We had sufficient security resources both present and then available for whatever would come up. And we will have the same kind of plan for future incidences or threats that we might see. I know there's some discussion nationally about what happens on January 20th, the inauguration of the president, and days leading up to that. We'll continue to evaluate the information that we have and make good judgments on it. I assure everyone that we're going to protect individuals and citizens and public servants as they are in the Capitol, as well as the Capitol itself as a seat of our democracy here in Arkansas.
What factors are you going to use to decide whether or not to activate the National Guard or to tell people to stay away from the Capitol?
Well, the factor would be that if civilian law enforcement is not sufficient to handle the threat or the violence that might be anticipated or that we might see. And that's the role of the National Guard, is a secondary support to back up civilian law enforcement. At this time, I have not seen anything that indicates that our civilian law enforcement resources cannot handle any threats that we see at the present time, but we'll continue to evaluate that. As you know, that last year we did call out the National Guard, but it was actually after visibly seeing the actions that were taken that crossed the line into destruction of property, and then we at that time made them available.
For people who are going to be eligible for the vaccine, like particularly the older Arkansans, what are they supposed to do to get in line to get the vaccine? Do they just have to call around to different pharmacies, or?
Well, they need to look at their community and determine where the doses, the vaccine is available. The pharmacies are in every area that can be covered. And then secondly, you have your hospital as an option. And so we'll be continuing to provide more information, but much of this information will be distributed locally so people will know where it is that they can go and what they need to do to get on the list. It's not all going to happen Monday, but they've already started. Creating
in your arm. So the whole point of it is that we want to be able to communicate, and make sure that everyone understands that these are our priorities, and then we're going to get you in, and so that we can take some of the confusion out of the equation, because if people start signing up for lists in 5 different locations just trying to get it, it confuses the system, so we can prioritize who's going to get the shot, if that makes sense.
There's not going to be a centralized way to get on the list.
The way the system works is that we have a program that communicates with all our systems in the CDC, and that system is where the request for a dosing comes into, and then that's how we prioritize where it's going to go in the state. And so we're using that system as our system of record, and that's how we're going to go in. And so when the people that are going to upload that system to tell us that there is a demand for the vaccine, that's going to come in from the providers. So that's going to come in from either a pharmacy or a hospital. And then from that, it'll come to the Department of Health, and then we'll put in the request to get the dosing sent to that location.
But there's nothing to prevent somebody from signing up with multiple pharmacies.
How are you going to increase the capacity you're talking about? Is that capacity of people to actually administer shots, people to make phone calls, and make sure people know that they're notified that they can come get the machine? Where is that personnel going?
So first off, right now, we've only had 212 pharmacies that have been involved in the 1A program. And so the first thing we're doing is we're trying to expand that capacity to other pharmacies around the state. We still haven't exercised, the Department of Health has a long history of flu vaccinations and getting out there with their local health units. We haven't done that. We're also talking with the military department to be able to put together strike teams, with our local health units to go into a community and provide those shots. So there's a whole lot of things that we can ramp up to. I think the first thing is making sure we're spreading it out to the hospitals for large population areas and the pharmacies and expanding the number of providers that we have here in the state. Sir.
Let's go remotely. Is there any questions online?
Governor Rowley Hoyt with THB 11. I just heard the Colonel say that there'll be a centralized waiting list. There's already several waiting lists being created out there by these individual pharmacies. Are the people who have signed up on those lists, do they need to get off them or sign up for something else now?
No, that was miscommunication in some fashion. The Colonel said that there is not going to be a centralized list. This is lists that are compiled at the local pharmacy or hospitals or what the provider that's available. So there's not a centralized list.
All right, thank you for that. Another quick question. Lieutenant Governor Griffin today tweeted that he would rather see larger venues, something more along the lines of mass vaccination clinics. It doesn't appear in this plan right now like you're going in that direction. Why is that?
Well, that's, as General indicated, the mass distribution option is still as part of the plans. And so that absolutely can be done. But it's not, it would not be good to have War Memorial Stadium for a mass distribution center when you only got 50, a limited number of supply of doses. So you have to organize this in a way that makes sense. And this is, and there will be opportunities for more mass clinics whenever we have the supply and when it makes sense. Now, for example, some of the school districts have over 1,000 teachers. Well, that's pretty much of a mass distribution effort whenever we get to that particular school district. Whenever you get to some employers, which is down the road, you're going to have a large number of employees that will be vaccinated, and that's going to have to be in that type of a mass clinic. So all of this is part of the plan. And that is one option that's there. But it is important that our pharmacies, which are in every community, and our community health clinics, our Department of Health, which historically has done mass clinics for flu vaccinations, they will continue to use that capability in the future.
Governor, this is David Ramsey with the Arkansas Nonprofit News Network. While we await the vaccine, the National Academy of Medicine and 9 other national organizations last month issued a call for states to establish statewide crisis standards of care plans for the pandemic. And my understanding is that I think more than 30 states do have a crisis standard of care plan in place, basically something that would establish protocols for how to allocate scarce resources if the capacity situation does reach a kind of crisis point, and to kind of have a plan for that statewide. My understanding is that's kind of in development in Arkansas. I guess, could you just speak to where things stand, if there is going to be a plan released, and whether something like developing a crisis standard of care would help manage the pandemic right now?
Dr. Romero, would you address that?
So we hope we never have to activate a crisis standard of care. That would indicate that we have reached the limit of our capacity of caring for patients, both in the hospital and on ventilators. So that standard of care, that document, is in the process of development. It's in the near completion state. We hope to have a final review of this within the health department and contributing authors, and then we'll pass it to the governor for his review, but it should be coming shortly.
Next question.
Hi, Governor. This is Rachel Herzog with the Arkansas Democrat Gazette. I wanted to go back to the topic of the FBI warning of attacks on state capitals. Do you think that Arkansas is less likely to see any kind of riot, not having been a swing state in this past election? Or is there any other kind of insight you can give us based on your background in Homeland Security?
Thank you, Rachel. And the answer is less likely. If you look at where we are in Arkansas, the information that we have, and we have long history because mine goes back into the 80s, in which we had neo-Nazi groups, and we had a white supremacist group in Arkansas. We had Posse Comitatus here, and so I don't want to diminish the fact that there's work to be done here in this state. But in terms of challenging state authority or coming in and protesting what's happening in Washington, I did not see that as you've seen in many other capitals, so I'm hopeful that it's less likely to happen here. I have more confidence both in our law enforcement capacity, but also in our citizens. So I'm hopeful of that being the case. And of course, everybody has the right to protest. You don't want to diminish that, but in terms of violent acts or other destruction of property, I expect that to be less likely here, and I hope that's the case. But we will be prepared in the event those circumstances change. Next question.
Hey, Governor, this is Josh White with KAIT. I want to ask a quick question off of COVID. In your State of the State address this morning, you had mentioned the hate crime bill that you were hoping to pass. It didn't seem like you got lukewarm response from applause. What is your gut feeling on that and how the General Assembly will tackle that this year?
Well, I thought it was well received as important information, as something that they are thoughtfully considering, and I expect that to proceed in the normal fashion of debate and listening to constituents and our community. So I was encouraged and not discouraged by it. We'll see where it goes.
Yes, good afternoon. One last question, sorry, on the State of the State. Any nostalgia on this is your last one? Anything looking back that stands out?
Just optimism, and as I said, we started aggressively and strong, and we're going to continue that way. And I was referencing this being my last regular session, but it's not my last session of the legislature, not my last State of the State address. And so it's sort of hard to be nostalgic whenever you got a lot of work to do, particularly during a pandemic. So I switched from the State of the State address very quickly to vaccinations, and that'll be on my focus simultaneously with the upcoming legislative session. Just one. Did I hear one more remotely? Then we'll come back to the table.
Yes, good afternoon. It's Brett Rains with 4029 News. Back to the rollout for the first group of Phase 1B. For our larger school districts, a little more specificity. What are we advising, like teachers with these school districts? Should they contact their pharmacies, or should the school districts wait for a little more information from the state to try and organize like a mass flu clinic, for lack of a better term?
A great question. And first of all, the teachers should first contact their principals and superintendents and say, what's our options, what's our plan? And the superintendent, the leadership of the school should be contacting their healthcare providers and trying to determine what's the time frame that particular provider, whether it's a hospital or a pharmacy, will have sufficient doses to go into the school and do a clinic and vaccinate them. And so this is a ground up from the grassroots up initiative, where it starts with the school district contacting the provider and managing it when we have the doses that they can schedule that clinic. And so that is what they need to do. I'm sure that there will be other options that will be considered, but that's the most logical one and where we see it being able to proceed the quickest. Back to the table. Any other questions?
I want to go back to the question, this may be for Dr. Romero as well too, on the percentage of population that's been vaccinated, the 2.7% versus what the CDC had, I guess it was, I don't know, it was 1.4%. Is that number that much better in terms of where you hope to be at this point? Is that still seems like it's a pretty low number?
Well, I'm not happy with it. And that's one of the reasons we're moving into the first two categories of Phase B. I don't think anybody who wants to get all the vaccinations out can be satisfied with it. But I also know that the CDC set up a 3-day lag in reporting. And this is for all the states, but the focus was not necessarily the paperwork, but getting the shots in the arms. And so we're dependent upon pharmacies and hospitals entering the data, and they have 3 days to do it. And then we collect the data, and it's transferred to the CDC, and they've got to upload it and get it right too. So there was a little bit of a gap yesterday. But you know, this is a logistics challenge, and that's why we brought on the program managers, the experts in logistics to help us to manage this and to accelerate that throughput, because we're getting supplies, we're getting them out to the population. We want to reduce the delay there and to get it out quicker. That's the whole objective, is to shorten that time. It takes, when you have a limited supply, it takes a lot of partners to accomplish that. Dr. Romero, this was addressed to you, and I started talking. Do you have anything else there?
So, no, I mean, we would like to have a lot more vaccine into arms at this point. But if you look at us in comparison to other states, we're all in the same boat. There is only so much vaccine to be distributed. We're getting that vaccine and we're pushing it out. We will push it out faster as we develop more and more capacity to do so. So we will reach out to more Arkansans in the future.
We probably have time for one more question if it is. Yes.
Since there's 2 doses involved with each person, do you have any information on how many unique people have been vaccinated at this point? And also just kind of related to that, I heard there's some reports the federal government was going to go ahead and just release the second doses as well. So how significant will that affect the amount of vaccine that we're getting?
Well, some have already received the second dose. Some healthcare workers have, others are in line for it. And so the impact for us is it gets more doses to us quicker, and allows us to manage both the first and the second dose. You know, we're not going to the UK model of just trying to get 1 dose for everybody. We want to stick with that program that the FDA approved for the 2 doses, but it gives us more flexibility to get that first dose out more quickly. Dr. Romero, on the unique.
So you're actually talking specifically about the metrics that need to be looked at, and that is not just the number of doses you're giving, but you also want to look at how many people have completed the immunization schedule. So again, I will rely very heavily on Colonel Ator to give us that, to get that granularity. We're going to be getting that for us, and then we'll be able to provide it to you. But it is a very good question. We also want to have enough vaccine to begin the immunizations. I have read simply the press release from that conference. We understand that we will be receiving more vaccine, and that vaccine will need to be used for both the primary dose and then the final dose in each case. There will be vaccines in the future that require only a single dose. So those will also enter the mix. So this plan of vaccination will become progressively more complex as we move into this year.
Thank you all very much today. Have a good afternoon.